Hi, my name is Vanessa Cabrera. I'm the provider at Solaria Urgent and Primary Care. So this video is primarily for my weight loss patients, but for anyone else who kind of just needs to know how to draw up Semaglutide or Tirzepatide from a vial, this may also be useful to you as well. Dosing will likely not be the same depending on who you get your medication from, unless you're patients who are receiving your medication from my pharmacy, okay? So when you get your vial, it's going to come with a gray top. So until you pop this top off, this top is considered sterile. So aside from that, you're also going to have in your kit your alcohol prep pads. We're just going to take one of these out. And your insulin syringes. So we'll go ahead and pop this top off. You want to make sure that you don't touch the rubber in the middle, because when you do, you'll now have to start wiping it off with alcohol. So we're going to pop that off, okay? And that's going to be ready to go. Now, for future uses, of course, you won't have the top on there. So what you will do is before you draw up the medication, you're going to go ahead and just wipe the top of that vial, okay? So if you're a patient at my clinic, you have received one of these that tells you exactly how much you should be administering per dose. So this is the one I have up for semaglutide. Tirzepatide also has a different schedule. For today's purposes, we're gonna just use the semaglutide schedule. So on your syringe, you're going to notice, you're gonna take off the back of the plunger so that you can manipulate it. So you will notice that it's listed in increments of 10. So 10, 20, 30, 40, so on and so forth. If you are on Tirzepatide, you are incremented, you have doses of 25, 50, 75, so on and so forth. So in those cases, each one of these lines is considered 2 units. So this would be 22, 24, 26, 28, and now to 30. So important that you want the base of the meniscus to be right at where that line is for the dose that you're looking for, okay? So for today's purposes, we're going to say that we are currently on 0.75 milligrams, 30 units of semaglutide. So really important with this is these needles are insulin needles. They're very, very flimsy. So you always want to make sure that you're doing everything at a 90-degree angle. When you take off the cap, you're doing it at a 90-degree angle. When you're injecting, you're doing it at a 90-degree angle, as well as when you're pulling out. That's going to avoid that needle bending and you having any of those kinds of issues. So we've got that done. So you want to pull back in air the amount of medication that you are wanting to draw up. So that's just going to make it easier for you when it comes time to pull back, to pull the medication into the syringe, and is going to avoid having any air bubbles in there. So of course, when your vial is full, it's nice and easy. As your medication starts going down towards the bottom, you may have to pull back on the needle a little bit so that it sits at the base so that you don't have any problems pulling back on the medication. So we're going to go ahead and inject the air, and now we're going to pull back until we get to 30. So perfect, we're right at 30, and we have this tiny little air bubble. That's not a problem. If you see that you have any air bubbles, that one's not a problem, but anything bigger, you can flick it a little bit, or you can manipulate it until you see that you don't have any. But again, ejecting the amount of air into the vial equal to the medication that you're trying to take out will usually avoid you having any of those types of issues. So again, you're going to withdraw at a 90-degree angle. You are now ready to inject. So you're going to take another alcohol pad, And then as far as your injection sites go, so wherever you have belly fat, you can inject. I usually recommend that you rotate your sites. Any of these 4 quadrants, if you were to cut the stomach into 4 pieces, you could go ahead and inject to. These injections are once a week. So let's say if this week you're injecting into this side, next week you may want to inject into the other side. So you're going to just go ahead and rub that site with alcohol. You want to let it dry. And then again, you're going to inject. Once the needle is all the way in, you're going to push the plunger all the way down. I usually say count to 1 or 2, then go ahead and withdraw your needle. And then you don't ever want to recap your syringe. If you're one of my patients, please go ahead and dispose your syringes into the red biohazard container that we have provided you with, and bring it into the office whenever it's full so that we can dispose of it for you. I hope you have found this tutorial helpful. If you have any questions or comments, please leave them below. If you're one of our patients and you have any other questions or concerns, please feel free to reach out to our office. God bless.